Hello everyone, welcome to another podcast series brought to you by the Urban Foundation with support from Aspire Coronation Trust Foundation. I am Dorcas FOLUKE, and with me here today is a wonderful guest, Dr. FOLUKE SARIMIYE. She is the consultant clinical and radiation oncologist, University College Hospital, Ibadan. You're welcome, ma.
Thank you for having me. Pleased to be here.
Alright, so today we'll be talking about breast cancer. So if you've not watched the first episode or you're not listening to the first episode, please, you can check Cancer Care in Nigeria. Today we want to focus on breast cancer and we have the expert here. So she's going to be telling us what breast cancer is all about, the risk factors, how can we prevent it, the screening, and also she's going to talk about self-breast examination, signs that women should know, like, oh, if you're saying this and that, then you know something is up, you need to go and check yourself. So she's going to be talking about the myths and misconceptions about breast cancer and also the treatment options, especially here in Nigeria. So you are really in for a good deal. It's going to be value for your time, and I want you to stay with us till the end. So over to you, ma. So can you just give us like a brief about what breast cancer is all about?
Okay, breast cancer is cancer occurring in the breast, which is a tissue that both male and female do have. It's just that it's more grown of, I can use that word, in females as compared to male. So breast cancer, as I've said, is cancer occurring in the breast, and it's actually the most studied cancer compared to other types of cancer. It's a prototype for other types of cancers because it's the most studied, and researches and studies and results have been used from breast cancer to even evaluate and get more knowledge about other types of cancers. Out of all the, we have over 120 types of cancers worldwide, and over 30 cases have been reported in Nigeria. And of all these 30 cases, breast cancer represents 22.7% of breast cancer. In, I think, 2020, approximately 125 new cases, 125,000 new cases of cancer was reported. And breast cancer was estimated to make up about 22.7% of these new cases in Nigeria. It is the most solid tumor occurring in females. So that's basically what breast cancer is globally and also in Nigeria today.
Wow, that's a lot.
So yeah, it's a lot. It's the most common cancer, when you put both sex together, male and female, followed by prostate cancer and cervical cancer. So it is really, it's prevalent in Nigeria.
Oh, thank you, ma'am. So knowing the fact that it's very prevalent, and like, what are the risk factors associated with breast cancer? What are the things actually responsible for us to have so many cases, like especially in developing countries like Nigeria?
Okay. Before we used to think that cancer was like the disease of the Western high-income countries, but we're beginning to see, more and new cases here in the country. For cancer generally, we have modifiable and non-modifiable risk factors, which also affects breast cancer. For breast cancer, we have unmodifiable risk factors, like the things that you can change. So, like your age, increasing age, your female, breast cancer occurs more in female as compared to male. And then you have your age at menarche, that is when the lady starts her menstruation, and then you have your age at menopause. Those are physiological things that you can control as a female. So when you start menarche very early, maybe like the age of 8, 9 and all that, your exposure to estrogen, which is a beautiful hormone, is what makes us female, is what makes us attractive and all that. But when you're exposed to estrogen for a very long time, it boosts or it kind of drives development of breast cancer. And then when you don't, your menopause is also delayed. Your menopause is you're attaining menopause maybe above 55 and all that. So that long exposure also is one of the risk factors. So those are unmodifiable risk factors, things that you can, but you can't control. Then also, breast cancer is been known to be a little more aggressive. There are different types of breast cancers, which are we have molecular types of breast cancers, and then the aggressive ones are found more among black descent. So that you can't change your race. So being a black, being a lady of black descent could also increase the risk of developing breast cancer. Very good to also exposure to unopposed estrogen contraceptives can also be a risk factor for breast cancer. Attaining the parents still at the age of 30, and also because pregnancy will definitely help the production of estrogen when you start having progesterone, but not getting pregnant before the age, after the age of 30 also could increase the risk factors. So we now have modifiable risk factors, which is what is in our hands, something that we can control, we can do. And that has to do with, basically, these are risk factors for not just breast cancer, but for any non-communicable disease. We're talking about tobacco use, we're talking about alcohol consumption, we're talking about sedentary lifestyle, physical inactivity, we're talking about diet, where consumption of red protein, fatty food and all that. So we can control our diet by taking more fruits and vegetables and white protein, which has less oil and fats that could drive generally these non-communicable diseases such as also breast cancer. Having a sedentary lifestyle, we should include exercise in our daily activities. Just 3 minutes, 15 minutes walk in a week. It's okay to be in a proper shape. So.
Thank you, man. That was so elaborate. So we have the modifiable factors and the non-modifiable factors. Now, because we have the non-modifiable factors, we are especially in Nigeria, we are black, and some things cannot just be changed. So, which way is there a way we can prevent, or let's say for early diagnosis for things that we can't just adjust to? What should we do for screening? What are the screening options available for breast cancer?
If you took the word out of my mouth, I was going to say that for the early detection is key. I want to talk about early detection is key, and when we talk about early detection, that's what screening is one of the methods for early detection. So it's important because we've had cases where people are diagnosed with breast cancer and they don't have all this. They don't have all this modifiable risk factors. They don't smoke. They don't consume alcohol. They eat well, but because of genetic mutations, still they come down with breast cancer. But one of the things that we should encourage Nigerians and our loved ones is that early detection saves life. Screening. Why is screening so important? We advocate for monthly breast exams. We advocate for clinical breast exams. I think we advocate for screening. I will talk about that, on how we should do that. We do that because mammogram, which is the screening for breast cancer, will detect the lump that a lady can detect 2 years before. So when you're doing your clinical breast examination or you're having your breast exams every month, you might feel the lump. But what mammogram will do is check that from the age of 40 when you start is that even before you feel it, it will detect it 2 years before it becomes palpable. So it's important that our conception, our mindset changes. I think we have a challenge with Africa taking care of our health, going for regular medical screening, especially when we get to the age of 40. We need to imbibe and have a culture of having regular medical screening. That as I age, it should be part of my plans, it should be part of my goals to be in good health. So encouraging and having a podcast like what you're doing right now, what the Ever Foundation is doing is so important. You are educating people about the importance of screening, early detection, early diagnosis, which is so much better. The emotional, financial, and even the intellectual things that come into taking care of breast cancer at a stage 1, it's so much better than when someone comes in at a stage 4. So it's screening is very important, cannot be overestimated.
All right, thank you so much, Mark, for that. Talking about monthly examination, I want to assume that is the self-breast examination.
Yes.
Okay, so like how often should mammogram be done?
So breast screening is basically divided into monthly breast examinations, clinical breast examination, and then we have mammogram. So from the age of 20 to 39, if there is no family history of breast cancer, we ladies are advised to have a monthly breast examination. That is, you examine your breast 3 to 5 days, preferably after the menstrual cycle, because during the menstrual cycle around that time you wouldn't feel the texture of the breast differs. But after 3 to 5 days after menstruation, the natural state of the breast comes on. So we advise for monthly breast examination during that. Then clinical breast examination by a health professional every 2 years. Then when you get to 40 to 55 years old, you still continue with the monthly breast examination and the yearly clinical examination by a health professional, and then you introduce mammogram. Now 40 to 45 years, you have the choice of doing mammogram every 2 years, or you can do yearly. But for when you're 45 to 54 years old, it's important that you start a yearly mammogram. Like I said earlier, mammogram is just a screening test which will detect a lesion in the breast earlier, like about 2 years earlier, before a lady even palpates or feels a lump in her breast during monthly breast examination. And then 54 years and above, 55 years and above, now you have the choice to have your mammogram every 2 years or to continue yearly. So that's the screening test. So breast examination, it's just you. I don't know if I describe it or something.
Yeah.
Yes. So you're supposed to stand in front of a mirror and then observe and see how both breasts look. Because one of the things why it's important that if you don't know how your breast feels or looks normally, if there's a change, you wouldn't even really know. So you're supposed to examine and check for any, changes in our skin color or something just different. If it's okay, usually don't get worried. One of the breasts sometimes it may be bigger than the left, maybe than the right, or may be bigger than the left, so it's fine. So it's kind of fun, and then you observe just to see is everything okay, like the skin, the nipple, and that is fine. But then you raise if you want to examine the left breast, you raise your right hand. And so if you want to examine the right breast, you raise your right hand up and then you put your left hand on the breast. So what we do, you have a superficial palpation and then deep palpation. Superficial palpation, you divide your breast imaginary lines into 4 quadrants with A, B, C, D. So you want to feel A, you want to feel B, you want to feel C, and then you want to feel D to C. And then, okay, do I feel anything? Now, don't get worried. Under the breast tissue, there are different things that we have, the veins, the vessels, and all that. So there are definitely things that, but what you're feeling for that is there something nodular, something a bit hard, like a small, like a peanut or granite side that could be there. That's what you're feeling for. So when you do that, then you go downwards to now what we call deeper palpation to feel for anything, and then you also do that to your axilla. Why I said your axilla is because sometimes breast lumps just shows up at the tail of the breast here towards the axilla. So it's important that you also examine the armpit, or for the armpit, and also the breast tissue. So that's how we do monthly breast examination. And then, like I said, yearly breast clinical breast exams. You go to the hospital, any primary health center, any health professional trained in that area can just help you examine the breast before you continue with the mammogram.
Okay, thank you for the detailed description. So I'm really glad that people can easily walk into the primary center and get that, because that is the closest to people in the rural community. Yes. So can you just mention some signs of breast cancer, like warning signs that when you see, you know, okay, you need to go to the clinic?
The most common warning sign is a small lump in the breast. And this lump, if it's the early stage, is still a mobile lump in the breast. So there are, now as the breast cancer progresses, there could be other signs that would come up, but the most common is a small lump in the breast. It could be, if it's prolonged, it will be fixed, but if it's very early, it will still be mobile. That is, you can feel it when you put your hands on your finger on it, you can feel it in between your, I mean, beneath your skin moving. So, but as the cancer progresses, you begin to see maybe sometimes with a nipple discharge, you can see a nipple change. Your nipple is supposed to be slightly protruded, but it can become inverted. You can see some people have bloody discharge from the nipple. Then skin changes. So sometimes you can have pain, but really the most common thing that people see at early stages is a lump. And as it progresses, there'll be massive skin changes on the breast, where it begins to look funny and maybe look like an orange peeled skin.
Okay, thank you for giving us those signs. So anyone who notices any of this sign, you know you need to get to see your doctor. So lastly, I would like you to mention the treatment options for people that are diagnosed for breast cancer. Like, is there a particular treatment for all types, or are there options, especially in Nigeria?
Okay, so for breast cancer is a very broad type of disease, because within breast cancer we have several types of breast cancers. We have molecular subtypes of breast cancers, and research keeps going on and we keep seeing different types of breast cancers. So Lady A may have breast cancer, but the treatment option might be far different from Lady C. So that is why it's important when people are diagnosed, we ask what we call an IHC to let us know the kind of breast cancer it is. But generally speaking, the treatment options are surgery. It could be complete mastectomy or partial, depending on what area of the breast is affected and depending on the stage and the clinical status of that patient. You would have radiotherapy afterwards. Then there could be chemotherapy, maybe before the surgery or after the surgery. What we call is a neoadjuvant or adjuvant treatment for chemotherapy. We also have targeted therapy, because we have some molecular subtypes that do better with some targeted therapy. So we have immunotherapy, and these are basically the broad treatment options that are available. And the treatment is not for cancers generally. It's not for Nigeria. It's not so available. But what the first step, that even having the facilities or the equipment that is available now in Nigeria, we don't have to. I had a patient where we had to. Came all the way from Cameroon for radiotherapy in Nigeria, and I'm like, you don't have radiotherapy machine in Cameroon? And they're like, no, we don't. So the fact that at least in Nigeria, you don't have to go out of the country to have your treatment, it's a step in the right direction. So I say, no, what we're doing now is about financial burden, how to get the access to radiotherapy treatments and other things are available in the country.
That's a relief that we have access to care right here in the country. Thank you so much, Ma, for your time. It's a pleasure to have you here, Dr. FOLUKE SARIMIYE. And this session is brought to you by Dove Urban Foundation with support from Aspire Coronation Trust Foundation. So for more inquiries, you can call our line 0808 777 9043, and you can also reach us via mail info@dove-urbanfoundation.com. So you can reach out to us on social media, and I remain your host, Dorcas Faboyero. Thank you.
Thank you.